Question 1. A nurse is assessing a client 12 hours after a total abdominal hysterectomy who reports increasing abdominal pain and shoulder tip pain. Which action should the nurse take first? A. Administer the prescribed analgesic. B. Assess for abdominal distension and vital signs. C. Encourage ambulation. D. Apply a heating pad to the abdomen. Answer. B. Assess for abdominal distension and vital signs. Rationale. Shoulder tip pain after surgery may indicate diaphragmatic irritation from internal bleeding or gas. Assessment and vital sign evaluation are priority before interventions to rule out hemorrhage. Question 2. A patient with polycystic ovary syndrome (PCOS) is prescribed metformin. Which finding indicates the medication is effective? A. Decreased blood glucose and regular menstrual cycles. B. Weight gain and stable mood. C. Decreased fatigue and insomnia. D. Lowered estrogen levels. Answer. A. Decreased blood glucose and regular menstrual cycles. Rationale. Metformin improves insulin sensitivity, restoring ovulation and regulating menses in PCOS. Other options are unrelated effects. Question 3. A nurse is caring for a client with endometriosis who reports severe pelvic pain unrelieved by NSAIDs. What is the nurse's next best action? A. Notify the provider for stronger analgesics. B. Reassess pain and review menstrual history. C. Educate the client about surgical options. D. Apply heat to the lower abdomen. Answer. B. Reassess pain and review menstrual history. Rationale. Comprehensive assessment is necessary to identify worsening disease, rupture, or differential causes before escalating care or treatment changes. Question 4. A 32-year-old woman on oral contraceptives develops shortness of breath and leg pain. What should the nurse suspect? A. Hypoglycemia. B. Pulmonary embolism. C. Asthma exacerbation. D. Cardiac arrhythmia. Answer. B. Pulmonary embolism. Rationale. Oral contraceptives increase the risk for thromboembolic events. Symptoms of SOB and leg pain suggest a PE, requiring immediate action. Question 5. A nurse is counseling a client recently diagnosed with cervical cancer. The client refuses treatment, stating, "I'll rely on herbal remedies." What is the nurse's best response? A. Respect the decision and provide palliative care options. B. Persuade her to reconsider medical treatment. C. Notify the healthcare provider immediately. D. Encourage the family to intervene. Answer. A. Respect the decision and provide palliative care options. Rationale. The nurse must uphold patient autonomy and support informed decisions, even if they differ from medical advice. Question 6. After a hysterectomy, the client develops a low-grade fever and foul-smelling vaginal discharge on postoperative day 3. What is the priority action? A. Document findings and continue monitoring. B. Notify the surgeon immediately. C. Increase fluid intake. D. Encourage ambulation. Answer. B. Notify the surgeon immediately. Rationale. Foul discharge and fever indicate possible infection or abscess formation, requiring prompt medical evaluation. Question 7. During a pelvic exam, a nurse notices that a client becomes anxious and withdraws. What should the nurse do first? A. Stop the procedure and provide reassurance. B. Continue quickly to reduce anxiety. C. Ask another nurse to assist. D. Document the patient's reaction and proceed. Answer. A. Stop the procedure and provide reassurance. Rationale. Trauma-informed care requires halting procedures if a patient becomes distressed. Safety and emotional comfort are top priorities. Question 8. A nurse caring for a patient after uterine artery embolization notes decreased urine output and flank pain. What should the nurse suspect? A. Renal artery obstruction. B. Urinary tract infection. C. Post-embolization syndrome. D. Hemorrhagic cystitis. Answer: A. Renal artery obstruction. Rationale: decreased output and flank pain may indicate accidental embolization of renal arteries. A severe complication. Requires immediate medical attention. Question 9. A 19-year-old female with amenorrhea, galactorrhea, and headaches is being evaluated. Which test should the nurse anticipate? A. Serum prolactin level. B. Pap smear. C. Laparoscopy. D. FSH and LH levels only. Answer: A. Serum prolactin level. Rationale: elevated prolactin suggests a pituitary adenoma. Symptoms like galactorrhea and amenorrhea warrant prolactin testing. Question 10. A nurse receives report on 4 gynecologic patients. Which one should the nurse assess first? A. A client 6 hours post-laparoscopic tubal ligation with mild abdominal discomfort. B. A client with endometriosis complaining of dull pelvic pain. C. A client post-hysterectomy with a saturated dressing and tachycardia. D. A menopausal patient reporting hot flashes. Answer: C. A client post-hysterectomy with a saturated dressing and tachycardia. Rationale: this indicates active bleeding and possible hemorrhagic shock. Highest priority for immediate intervention. Question 11. A nurse is counseling a client with recurrent yeast infections. Which factor should the nurse address first? A. Blood glucose control. B. Clothing choices. C. Sexual activity. D. Probiotic intake. Answer: A. Blood glucose control. Rationale: poorly controlled diabetes predisposes clients to fungal infections. Addressing glucose regulation prevents recurrence. Question 12. A woman at 34 weeks gestation reports vaginal bleeding without pain. What is the nurse's first action? A. Perform a vaginal examination. B. Assess fetal heart rate and maternal vitals. C. Start IV oxytocin. D. Ask about contractions. Answer: B. Assess fetal heart rate and maternal vitals. Rationale: painless bleeding suggests placenta previa. Assessment precedes any vaginal exam to prevent worsening hemorrhage. Question 13. A nurse is preparing to teach a client about self-breast examination. Which factor would require modification of a teaching plan? A. The client is breastfeeding. B. The client is postmenopausal. C. The client recently had breast implants. D. The client has bilateral mastectomy. Answer: D. The client has bilateral mastectomy. Rationale: self-exam is not applicable post-mastectomy. Education should focus on chest wall observation and symptom reporting. Question 14. A client with uterine prolapse is prescribed a pessary. What should the nurse emphasize in teaching? A. Remove it weekly for cleaning. B. Avoid all sexual intercourse. C. Use only water to clean the pessary. D. Replace it daily. Answer: A. Remove it weekly for cleaning. Rationale: regular removal and cleaning prevent infection and tissue erosion. Other frequencies are inappropriate. Question 15. A nurse is caring for a client scheduled for a colposcopy after an abnormal pap smear. Which instruction should be included? A. Avoid douching and vaginal intercourse 24 hours before. B. Expect severe pain during the procedure. C. Fast for 8 hours prior. D. Take aspirin to reduce discomfort. Answer: A. Avoid douching and vaginal intercourse 24 hours before. Rationale: avoiding these activities ensures accurate visualization and sample integrity during colposcopy. Question 16. A patient on combined oral contraceptives reports severe leg pain and swelling. What is the priority nursing action? A. Assess for calf tenderness and notify provider. B. Apply compression stockings. C. Encourage ambulation. D. Increase fluid intake. Answer. A. Assess for calf tenderness and notify provider. Rationale. These are classic signs of DVT, a medical emergency requiring provider notification and diagnostic testing. Question 17. A nurse is providing post-operative care after vaginal hysterectomy. Which findings should be reported immediately? A. Pink-tinged discharge. B. Scant urine output and hypotension. C. Mild perineal soreness. D. Low-grade fever, 99.8 degrees Fahrenheit. Answer. B. Scant urine output and hypotension. Rationale. These may indicate hemorrhage or hypovolemia. Requires urgent assessment and fluid management. Question 18. A nurse is assessing a client with suspected toxic shock syndrome. Which question is most important to ask? A. Do you use tampons during menstruation? B. Have you had recent pelvic surgery? C. Do you have a latex allergy? D. Are you sexually active? Answer. A. Do you use tampons during menstruation? Rationale. Prolonged tampon use is a major cause of TSS due to Staphylococcus aureus toxin production. Question 19. A client on hormone replacement therapy, HRT, reports breast tenderness and leg swelling. What should the nurse do first? A. Assess for signs of DVT. B. Reassure this is a normal side effect. C. Reduce salt intake. D. Suggest wearing a supportive bra. Answer. A. Assess for signs of DVT. Rationale. Estrogen increases thromboembolic risk. Assessment for DVT is the priority before assuming benign causes. Question 20. A nurse notes that a patient on tamoxifen therapy reports abnormal vaginal bleeding. What should the nurse do? A. Notify the provider immediately. B. Encourage rest and hydration. C. Suggest reducing physical activity. D. Document findings and reassess later. Answer. A. Notify the provider immediately. Rationale. Tamoxifen increases endometrial cancer risk. Abnormal bleeding may indicate malignancy and requires prompt evaluation. Question 21. A nurse is assessing a post-vaginal hysterectomy patient who reports dizziness and soaking a peripad every 20 minutes. Which is the nurse's priority action? A. Reassess in 30 minutes. B. Notify the surgeon and start IV fluids. C. Elevate the legs and apply ice to the perineum. D. Document the findings. Answer. B. Notify the surgeon and start IV fluids. Rationale. Rapid pad saturation and dizziness indicate active hemorrhage. Immediate provider notification and fluid resuscitation are required. Question 22. A 25-year-old female presents with fever, severe lower abdominal pain, and purulent vaginal discharge. What is the most likely complication if untreated? A. Pelvic adhesions and infertility. B. Menorrhagia. C. Cervical erosion. D. Ovarian cyst rupture. Answer. A. Pelvic adhesions and infertility. Rationale. Pelvic inflammatory disease, PID, can cause scarring of fallopian tubes, leading to infertility and chronic pelvic pain. Question 23. Following dilation and curettage DNC, a patient reports foul-smelling discharge and a temperature of 101.4 degrees Fahrenheit 38.6 degrees Celsius. What should the nurse do first? A. Administer antipyretics. B. Notify the healthcare provider. C. Encourage fluids and rest. D. Document findings. Answer. B. Notify the healthcare provider. Rationale. fever and malodorous discharge indicate postoperative infection or retained products of conception. Requires prompt provider notification. Question 24. A nurse suspects a ruptured ectopic pregnancy. Which assessment finding supports this diagnosis? A. Sudden shoulder pain and hypotension. B. Heavy vaginal bleeding with cramping. C. Irregular menstrual cycles. D. Nausea and breast tenderness. Answer. A. Sudden shoulder pain and hypotension. Rationale. Shoulder pain and hypotension indicate intra-abdominal bleeding from rupture, requiring immediate emergency surgery. Question 25. After uterine fibroid embolization, the nurse notes a patient with increasing pelvic pain and foul-smelling discharge. What is the priority nursing action? A. Provide analgesics as prescribed. B. Assess vital signs and notify the provider. C. Apply warm compress to the abdomen. D. Encourage ambulation. Answer. B. Assess vital signs and notify the provider. Rationale. These signs suggest infection or necrosis of embolized tissue. Requires urgent evaluation to prevent sepsis. Question 26. A nurse is caring for a post-laparoscopic ovarian cystectomy patient with a heart rate of 118 bpm, low urine output, and pallor. What is the most likely complication? A. Internal bleeding. B. Hypoglycemia. C. Infection. D. Anxiety. Answer. A. Internal bleeding. Rationale. Tachycardia, pallor, and decreased urine output suggest hypovolemic shock due to internal hemorrhage. Question 27. A woman treated for PID asks why she needs her partner treated as well. Which response by the nurse is best? A. It helps prevent reinfection and further complications. B. Your partner might have a different infection. C. It's just a routine precaution. D. It's required by hospital policy. Answer. A. It helps prevent reinfection and further complications. Rationale. Both partners must be treated to prevent recurrence and transmission of infection. Question 28. A nurse is caring for a post-total hysterectomy patient who has no urinary output 6 hours after surgery. What is the nurse's initial action? A. Notify the surgeon immediately. B. Assess bladder with palpation or bladder scan. C. Encourage oral fluids. D. Recheck after 2 hours. Answer. B. Assess bladder with palpation or bladder scan. Rationale. Postoperative urinary retention is common. Bladder assessment determines cause before notifying provider. Question 29. A patient with suspected ovarian torsion reports sudden, severe pelvic pain and nausea. What should the nurse anticipate? A. Emergency surgery to restore blood flow. B. IV antibiotics and fluids. C. Observation for 24 hours. D. Pelvic ultrasound after 2 days. Answer. A. Emergency surgery to restore blood flow. Rationale. Ovarian torsion is a surgical emergency to prevent ischemia and necrosis of ovarian tissue. Question 30. During care of a post-cesarean section client, the nurse notices increased bleeding and a boggy uterus. What should be done first? A. Massage the uterus firmly. B. Notify the provider immediately. C. Increase oxytocin infusion rate. D. Start another IV line. Answer. A. Massage the uterus firmly. Rationale. First-line intervention for uterine atony is fundal massage to stimulate contraction and reduce bleeding. Question 31. A nurse receives report on 4 postoperative gynecology patients. Which should the nurse assess first? A. Hysterectomy client with HR 118 bpm, BP 88 over 54 millimeters of mercury. B. Myomectomy client with pain score 6 out of 10. C. DNC client with mild nausea. D. Laparoscopy client with shoulder pain. Answer: A. Hysterectomy client with HR 118 BPM, BP 88 over 54 millimeters of mercury. Rationale: hypotension and tachycardia indicate possible hemorrhage. Immediate priority. Question 32. A patient reports sudden abdominal pain and dizziness after a recent molar pregnancy evacuation. Which complication should the nurse suspect? A. Uterine perforation. B. Infection. C. Emotional distress. D. Adhesion formation. Answer: A. Uterine perforation. Rationale: post-D and C sudden pain and dizziness are classic signs of uterine perforation. Requires immediate surgical evaluation. Question 33. A patient diagnosed with vulvar cancer refuses surgery, stating her spouse will not find her attractive. What is the nurse's best response? A. Would you like to talk about your concerns and explore options? B. You must focus on your health first. C. Your spouse will understand your decision. D. You should reconsider surgery. Answer: A. Would you like to talk about your concerns and explore options? Rationale: this promotes patient autonomy and emotional support through therapeutic communication. Question 34. A nurse caring for a patient with PID notes signs of septic shock. What is the immediate nursing action? A. Obtain blood cultures and start IV fluids. B. Monitor urine output. C. Administer oral antibiotics. D. Assess temperature every hour. Answer: A. Obtain blood cultures and start IV fluids. Rationale: in septic shock, early fluid resuscitation and cultures before antibiotics are life-saving priorities. Question 35. A patient after endometrial ablation reports heavy bleeding with clots 48 hours later. What is the nurse's best action? A. Notify the surgeon immediately. B. Reassure that it's normal. C. Apply cold compresses. D. Encourage rest. Answer: A. Notify the surgeon immediately. Rationale: post-ablation heavy bleeding indicates vessel injury or incomplete cauterization requiring provider evaluation. Question 36. A nurse is preparing discharge instructions for a patient treated for toxic shock syndrome (TSS). Which teaching is most important? A. Avoid tampon use during menses. B. Increase salt intake. C. Avoid intercourse for 2 weeks. D. Use antibiotic ointment on perineum. Answer: A. Avoid tampon use during menses. Rationale: tampon use is the leading cause of TSS recurrence. Avoidance is key prevention. Question 37. After diagnostic laparoscopy, a client reports shoulder pain and abdominal bloating. What should the nurse do? A. Encourage ambulation and deep breathing. B. Notify the provider immediately. C. Reassure that this indicates internal bleeding. D. Restrict oral intake. Answer: A. Encourage ambulation and deep breathing. Rationale: gas insufflation causes referred shoulder pain. Ambulation helps expel CO2. Question 38. A patient with a ruptured ectopic pregnancy undergoes surgery. Postoperatively, the patient expresses guilt for losing the baby. What is the most therapeutic nursing response? A. It's not your fault. This could happen to anyone. B. You can try again when your doctor says so. C. Would you like to talk more about how you're feeling? D. At least your life was saved. Answer: C. Would you like to talk more about how you're feeling? Rationale: this facilitates emotional expression and grieving, supporting psychological recovery. Question 39. A nurse is caring for a post-myomectomy patient who suddenly complains of dyspnea and chest pain. What complication should the nurse suspect? A. Pulmonary embolism. B. Pneumonia. C. Atelectasis. D. Asthma attack. Answer: A. Pulmonary embolism. Rationale: post-surgical immobility increases PE risk. Dyspnea and chest pain are hallmark signs needing emergency intervention. Question 40. A patient presents with profuse vaginal bleeding and hypotension following delivery. Despite uterine massage, bleeding persists. What is the nurse's next action? A. Prepare for possible hysterectomy. B. Apply ice packs to the abdomen. C. Administer antibiotics. D. Insert Foley catheter. Answer: A. Prepare for possible hysterectomy. Rationale: when bleeding is unresponsive to massage or medications, surgical management, such as hysterectomy, is indicated to control hemorrhage. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.